Good afternoon, all together. All these days, you saw a bridge between past and future. My colleague, Dr. Klinkenberg, and myself will try to show you how the approach with the Boenninghausen method is exactly that, a bridge between the past to the future to your daily practice of high value. My dear colleagues, for safe and successful treatment of acute diseases, we need both a good knowledge of materia medica and sufficient clinical experience. And in highly acute cases, we usually have only a few seconds to make a suitable therapeutic decision. Repertorization is then no longer possible. I have experienced this myself in my practice about 3 years ago. A 73-year-old patient sitting next to my desk and reporting her chronic complaints suddenly lost her speech and developed paralysis of the left side of her face and left arm. At the same time, she had a flushed face. As Hahnemann said, those were at this moment the perceptible signs representing the disease. It was obvious to think of an acute cerebral hemorrhage or insult, and my first impulse was to give the patient arnica C200, which I did. Her blood pressure was 200/100, pulse 110. But after 1 minute, her symptoms had worsened again. We then started the emergency plan of our practice for such acute cases, but at the same time, I gave the patient Lachesis C200. The patient's condition improved immediately. And when the ambulance arrived to transport the patient to the Freiburg stroke unit, the patient was already able to speak again. The paralysis of left arm and left face had improved, and the blood pressure now was 160/90. And when she arrived at the stroke unit, she was almost free of symptoms. And the neurological examinations at the hospital finally revealed a massive front right cerebral embolic ischemia. She recovered completely from that. Yes, fortunately, this is an exceptional situation. Usually, even in threatening acute situations, we have a moment to reflect and possibly perform a short repertorization. The aim of this lecture today is to show how this can be done easily and fast with the help of Boenninghausens Therapeutic Pocket Book and the software of Heiner Frey, Switzerland, if one focuses especially on polarity analysis and the exclusion of contradictions. I will demonstrate this with some case studies. We know that also in acute diseases, we should clearly perceive what we particularly should cure in every patient. This includes not only, as we all know, the totality of all alterations since the beginning of the acute disease, but also the causa occasionalis of the diseases and all that what is more striking, singular, uncommon, and peculiar in the present case. And those symptoms are most often found in the modalities of the case to be treated. Hahnemann explains in the paragraph 133, in order to determine the exact character of the symptom, the modalities are essential, because only through them it will be apparent what is peculiar to and characteristic of each symptom. And this has been confirmed by Boenninghausen. From this point of view, the modalities of the case have a much higher meaning than we have thought before, because they are never related exclusively to one certain symptom only, but often draw themselves like a red thread through the symptoms of the case. And the choice of remedy depends mainly on them. So far, Boenninghausen. By analogy and combination, as Boenninghausen says, it is possible to complete so far incomplete symptoms considering the modalities of the other symptoms of the case. The choice in today's presentation, I assume the basic knowledge of the Boenninghausen method. It is my intention today to describe the approach with the Boenninghausen method for solving acute cases with special consideration of the polar symptoms as well as the exclusion of contradictions in case analysis and repertorization. The practical part of the polarity analysis considers especially two elements: the contradictions and the polarity difference. To calculate the polarity difference, the grades of the polar symptoms of the patient are added for each remedy available for selection. Then, from the resulting sum, we subtract the grades of the corresponding opposite polar symptoms. The higher the polarity difference calculated from this, the more the remedy corresponds to the characteristic patient symptomatology, provided that there are no contradictions. The application of these insights about the polarity of symptoms leads to a quantum leap in the precision with which we can determine the correct remedy. In order to safeguard the choice of remedy, Boenninghausen recommended further checking whether one or more components of the patient's symptoms are in contradiction with the genius symptoms or characteristic symptoms of the remedy. This contradiction can also concern polar symptoms. That means symptoms that can also have an opposite pole. The polar symptoms of the homeopathic remedy to be chosen should be covered in high grades, between 3 and 5 if possible. And if the opposite pole has a high grade, but the patient's symptom has a low grade, the genius of the remedy does not correspond to the patient's symptomatology, and the remedy would be contraindicated. For example, we all know that the amelioration during movement would exclude always bryonia. Let's look at the first case. We talk about a teacher, 52 years old. After years with a regular menstrual cycle, this patient developed overnight an acute uterine hemorrhage. 10 years before, the gynecologist diagnosed a uterine myoma. Regular yearly controls showed a continuous growth of the myoma. Repeated hormonal interventions to control the hemorrhage failed. The day of the consultation, the gynecologist had transferred the patient to the hospital for uterus curettage. The patient showed up in the evening shortly before closing the office. She came to ask for help as a last try to control the hemorrhage before going to the hospital the next day. The hemorrhage exists since 4 weeks. She describes the hemorrhage as a strong, persistent bleeding with dark, tenacious blood and clots. Every physical exertion and every movement or lifting of a light weight aggravates the bleeding. The bleeding is also stronger in the evening and during the night. Resting and fresh open air improves her situation. She is tired and weak, anemic, breathless, going upstairs, and is unable to work. She has a hemoglobin of 7.0. She needed a few days ago an iron infusion. Another one is planned in the coming days. Of course, we face in this case not a real acute disease, but only a transient explosion of latent psora, as Hahnemann said. This means an activation of her chronic or miasmatic disposition. The myoma exists since many years, but hormonal changes in the context of a beginning menopause, persisting anger and mobbing in her profession as teacher might have made the myoma grow much faster and activate the hemorrhage. We agreed to trying to control the acute situation to avoid hospitalization and to approach her chronic situation afterwards. The repertorization of the acute situation is based on the following symptoms. You have the main symptom, the bleeding, the menstruation with profuse bleeding, menstruation too long, with blood dark and blood clotted or lumpy. And you see the polar modalities, the aggravation by physical effort during movement. She feels better at the open air, worse in the evening and lifting weights or overlifting, and better resting. The P behind the symptom means polar symptom. And here you see the repertorization and the polarity analysis and repertorization based on Heiner-Frei's software. In the first line, you see the number of symptoms found for each remedy. In the second line, the sum of the grades. And in the third line, the polarity difference, which is calculated by adding the grades of the polar symptoms of the case and subtracting the grades of the opposite polar symptoms. So again, in the first line, you see the number of symptoms of each remedy. I hope you can see it. The second line, the sum of grades. And in the third line, the polarity analysis, which is calculated by adding up the grades of the polar symptoms here. P, 3 plus 4 plus 3 plus 2 plus 3, 4, 3 results in 22, and we subtract one grade of an opposite polar symptom with a result of the polarity analysis of 21. The same with the bryonia, acidum nitricum, etc. And then you see here with a gray underlined, you see remedies like Nux vomica, sepia, and China, who have important contradictions to the symptomatology of our patient. Yeah? Nux vomica, sepia, and China. Contraindications means CI, C4. Sepia, we know, feels better by moving, by physical effort, worse in resting. This is complete contradiction to the symptomatology of our patient. Okay, you can see the remedy chosen here was Crocus sativus. I gave the patient 3 globally Crocus sativus C200 from Gudjons on her tongue in my office. She got also a few globally to take home with instruction to dissolve the remedy in water and to take every 2 hours 1 spoon of the solution, also the following day. She reports the next day that the bleeding immediately decreased, the hospitalization was cancelled, and under the treatment of Crocus sativus, the metorrhagia disappeared in between 3 days and never returned. The case-taking of her chronic situation resulted later on in the prescription of calcium carbonicum, which helped to reduce the size of the myoma significantly. And you can see here calcium carbonicum showing up already as a possible remedy for the situation of the patient. I repeat, this case is of course not a pure acute case, but because we know that the metorrhagia has a history with a growing myoma. But the repertorization and polarity analysis does not distinguish between acute and chronic diseases due to the fact that the currently existing symptoms build always the fundament of the choice of remedy, according to Hahnemann, who says in the paragraph 6, all these perceptible signs represent the disease in its whole extent, that is, together they form the true and only conceivable portrait of the disease. Well, we always try to confirm the medicine we found in the Materia Medica. And in the Materia Medica Revisa Homeopathiae, we find under Crocus sativus, for example, persistent flow from the uterus, sometimes stronger, sometimes weaker blood flow. The outgoing blood was tenacious, stringy, and blackish. Or constant loss of blood. The blood is dark, sometimes with clots at night, worse than during the day. It is the worst with every movement. Or the bleeding was irregular, the blood is dark, malodorous, lumpy, and fibrous, and the slightest movement aggravates. She feels better in the open air, and the incredible weariness, yawning, and tiredness, she felt better in the morning when she came into the open air. You see, the symptomatology of our patient is well represented here under Crocus sativus in the Materia Medica. Let's look at the second case I present you. Again, a teacher, 57 years old. After a physical exertion while skiing, she started first with an acute pain attack associated with a well-known coxarthrosis at the right side. A week later, that means 1 week before coming to my office, she developed an acute attack of multiple sclerosis for the second time in her life. She's extremely challenged in her job as a teacher for mentally and physically disabled children. She's also very concerned about her sick parents, as well as stressed by the fear of a possible recurrence of her breast cancer she had 5 years before. Her house physician, the neurologist, all her family put enormous pressure on her to undergo high-doses cortisone therapy in a hospital. And she has the referral to a neurological clinic in her hands, but refuses such a treatment and wants to try homeopathy before going to the clinic. I take the complete medical and homeopathic case taking. Summarizing the last stage of her actual disease, it means all the symptoms the patient suffers from at this moment of her life, including, of course, the symptoms of the multiple sclerosis, are as follows. Burning heat and feeling of swelling in the right foot, better by cold applications. Tingling and numbness of the right leg. Her vision is dim and foggy, blurred vision. She has difficulties to see with clarity. and it takes her a long time to focus clearly what she wants to see. Vertigo and balance disorder, as if she were drunk. Weakness, rapid exhaustion, everything quickly exhausts her. Drowsiness, thinking is tedious and difficult. Headache at her occiput extending upwards, and she cannot concentrate anymore. So, her main symptom is the strong and very disturbing vertigo, together with a drowsiness, dizziness, stupefaction, and general weakness. When walking, she has always hold on to something to avoid falling. So this is the first group of symptoms. Thinking is very difficult. She's sitting and lying almost all the time. She's unable to work, drive, to take care of her household. And now the interesting part, the polar modalities you see here. The aggravation by physical effort, by mental effort. She can't think and concentrate anymore. Better in lying position. Worse, turning the head sideways. The movement of head aggravates, and bending over. As concomitant, I wrote down here great anxiety, but I didn't give that symptom much value due to the situation the patient is. And let's have a look at the repertorization. You see calcium carbonicum. You see at the first the option calcium carbonicum, calcaria carbonicum. We have the option with natrium muriaticum and cocculus. This natrium and cocculus are also two medicines well proven in the pathology of the patient, and many more. Lycopodium here has an important contradiction. Lycopodium is worse lying down. We know that better usually during movement. The same with sepia and silicea. So the patient receives calcium carbonicum Q6 from Gudjons, 5 drops dissolved in water, every 2 hours 1 teaspoon. 2 days later, all symptoms are slightly better. She continues taking the remedy as before. 4 days after starting the homeopathic treatment, the vertigo and the leg symptoms have clearly improved. Again, 2 days later, she tells me that she still feels better, but the improvement is slower. I then felt sure about the medicine and gave her a much higher potency to accelerate the improvement. So I changed the potency to calcaria carbonica Q18, dissolved in water, 2 spoons every day. 3 days later, she feels again much better. The vertigo is significantly better. She's able to drive her car again, and the legs are free of symptoms. She continues now with calcium carbonicum Q18 dissolved in water, 1 spoon every morning, and reports 1 week later. Her vision, the weakness, the intellectual skills are about 90% good. She continues for 1 more week with the same remedy. Then I changed the potency to calcium carbonicum Q24 because there was no further improvement. Again, 1 week later, she is completely free of symptoms, is back to work, and was able to hike 1 hour without any problem. The following neurological control with MRI shows no actual focus of inflammation anymore and no aggravation in comparison with the first attack of multiple sclerosis she had 12 years before. In this case, calcium carbonicum was the fundamental medicine which helped the patient in all aspects in the following year. It's worthwhile to have also here a quick look at the Materia Medica, the chronic diseases from Hahnemann. And there you find a group of symptoms which is fitting very well the symptomatology of our patient. For example, he soon becomes very tired during bodily exertion, or great weakness of the imaginative faculty. With a very slight exertion in speaking, he felt as if his brain was paralyzed, chiefly in the occiput. He could not think nor recollect what was spoken of, with a muddled feeling in the head. Stupefaction of the head, like vertigo all afternoon. Fit of stupefying vertigo. The body bent forward to the left side, both when at rest and in motion. Vertigo, as if about to fall over after stooping while walking and standing. She has to hold to something, and all that with exhaustion. Again, the vertigo on walking out, especially in quickly turning the head, the dull, persistent, numb feeling in the head, and as well as the dimness of the vision. It's feeling good if you can prove what you do with the Materia Medica. You should do it. The last case. This time, a 15-year-old student. Her name is Nele. She has suffered from hay fever since early childhood. Until this year, the hay fever was limited to the upper respiratory tract, with a watery rhinitis, seizure-like sneezing, stuffy nose, and eye itching. The hay fever symptoms are worse between February and April, and during this time, she is noticeably tired. But this year's hay fever period is now completely different. For the first time in her life, Nele suffers from hay fever-induced bronchial asthma. She was able to compensate for the shortness of breath in the last few days so that she could manage her daily life to some extent. Since last night, however, the overall condition and the shortness of breath has worsened significantly. Recommended by a neighbor, she comes directly from the pediatrician to my practice for an emergency appointment. The pediatrician prescribed Nele a cortisone spray and bronchodilators and recommended the mother to go to the pediatric clinic in Freiburg if Nele's condition aggravates. Well, she suffers from shortness of breath during the slightest physical exertion and fast walking outdoors. She has also noticed that she is now uncomfortable lying on her back, and breathing is also worse in a closed room, especially when it's warm. She likes to sit near an open window. Humid weather and rain, she realized, worsens the shortness of breath as well. Talking is difficult now. Only when she sits upright is the shortness of breath bearable. Nele's mother, who accompanied her daughter to the consultation, also reported that Nele's general condition had changed in the last few days. That means since the onset of the bronchial asthma. She's now in a bad mood, stubborn, fritters away her time, doesn't care to work or to do her schoolwork. She doesn't want to see her friends, very unusual for her. She's constantly distracted, can no longer concentrate, and tends to withdraw from the family and makes a sad impression. The following symptoms, which represent the main symptom, have been repertorized with a therapeutic pocket book. Up there you see the asthmatic situation, breathing difficult, shortness of breath, And then the polar modalities. The aggravation by physical effort, walking fast, wet, cold weather aggravates. She feels worse in a room and lying on back. Warmth of room or stove aggravates as well. She feels better at the open air, sitting upright, talking aggravates. So, also here you see the repertorization up there. You see the first line, phosphor and sulfur, two very interesting remedies for this case. Afterwards, borax, alumina, etc. And Rastox, sepia, Nux vomica, all those remedies, gray underlined, have important contradictions and are excluded from the selection of remedy. So, the repertorization shows us that the most indicated remedies in this case are phosphor and sulfur. Boenninghausen uses in such cases the mind and mental symptoms of the patient since he got sick, to differentiate the most similar remedies at the end of the repertorization. And in this case, I prescribed with much success sulfur. In the Materia Medica from Jahr, we find under sulfur not only the main symptom and polar modalities of the patient. You see here well the script. We find the short of breath when walking outdoors and in motion, the shortness of breath at night when lying on back, starts up with loud crying. He's unable to breathe deeply. When he wants to breathe deeply, his chest feels contracted. Asthma while speaking and walking, etc. So we find not only the main symptom with all the polar symptoms, but also, as you can see here, the changes in the state of mind the patient shows since the beginning of her acute disease. Reluctance to any employment, idles away the time, indecisive, obstinate and grumpy, sadness, absent-mindedness, cannot concentrate on what she is supposed to do at the moment. Conclusion. The polarity analysis, that means focusing on the polar symptoms, that means on the characteristic modalities of the case, allows a quick analysis and remedy finding and leads to an efficient and reproducible choice of remedy and increases the precision of our prescription. Thank you for your patience.